Hi everyone, welcome back to my YouTube channel, and today we are going to talk about neonatal versus adult skull. So let's start our topic with introduction. Skull is bony structure that form the head and protect the brain, sensory organs and upper part of respiratory and digestive system. Skull undergoes significant changes from birth to adulthood due to growth, ossification and adaptation to functional demands. Neonatal skull is specially designed for birth and rapid brain growth, whereas adult skull is strong, rigid, and fully ossified to provide maximum protection. Features of neonatal skull. First is size and proportion. Neonatal skull is large in proportion to body, making up nearly one-fourth of body length, compared to one-eighth of body length in adults. The cranial portion is much larger than the facial portion. Bones and ossification in neonatal skull. In neonatal skull, bones are thin, soft, and not fully ossified. Sutures in them are wide and unossified that allow flexibility during birth. Fontanelles of neonatal skull. They are soft membranous gap where sutures meet. Major fontanelles include anterior fontanelle, that is the largest fontanelle. It is diamond shaped and it closes around 18 to 24 months of the age. Second is posterior fontanelle, that is triangular in shape and it closes around 2 to 3 months of the age. Then there are two sphenoidal and two mastoid fontanelles that are also present there. That allows skull bones to overlap during birth, that is called as molding, and accommodate rapid brain growth. Facial skeleton of neonatal skull. Facial skeleton of neonatal skull is underdeveloped compared to cranial vault. Jaw bones like mandible and maxilla are small and teeth are absent. Foramina and sutures of neonatal skull. Foramina and sutures are relatively larger to accommodate nerves and vessels, and sutures in neonatal skull are widely open and flexible. Now let's talk about features of adult skull. First is we will talk about size and proportion of adult skull. In adult, skull makes up one-eighth of body length. Facial skeleton is well developed compared to cranial portion. Bones and ossification in adult skull. In adult skull, bones are thick, hard, and completely ossified. Sutures are fused with age, especially in the elderly. Fontanelles in adult skull. All fontanelles in adult skull are closed. Only sutural line remain visible between cranial bones. Facial skeleton of adult skull. Facial skeleton is fully developed with well-formed mandible, maxilla, nasal bones, and teeth. It is adapted for chewing, speech, and facial expression. Foramina and sutures in adult skull. Foramina in adult skull are proportionally smaller than in neonates, and sutures appear as line and they are not wide gaps like in neonate skull. Neonatal versus adult skull. Neonatal skull is soft, flexible, and adapted for birth and brain growth, while adult skull is rigid, ossified, and adapted for protection and function. Cranial portion in neonates dominates, whereas facial skeleton is proportionally larger in adults. Fontanelles are present in neonates, but they are absent in adults. Sutures are open in neonates, but they are fused in adults. Clinical significance of neonatal skull. Neonatal skull has fontanelle. That fontanelle assessment helps detect dehydration, intracranial pressure, and delayed development. They are flexible sutures that allow molding during childbirth. Clinical significance of adult skull. Adult skull provide rigid protection to brain and sensory organs. Fractures in the adult skull can be dangerous due to lack of flexibility. Conclusion of this lecture video. Neonatal skull is specially designed to facilitate childbirth and rapid brain growth during early life, while adult skull is a strong, fully developed protective structure. Understanding the difference between neonatal and adult skull is important in pediatrics, anatomy, and forensic studies, as it highlights the developmental adoption of human body. And this was all about neonatal versus adult skull. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.